I'm Ηγέτης. I'm the founder of the DHI Medical Group, and this clinic here on New Cavendish Street is one of our main clinics of the group, and we perform the DHI treatments here, as well at this building, the DHI Academy, where we train doctors from all over the world, is based.
I'm Dr. Papanikolaou. I'm the medical director in Athens, and I'm a master surgeon for 5 years. On a daily basis I have some procedures. I'm doing this for 2007. Usually I'm traveling all around the world. Now I'm based in Athens because I'm the medical director.
DHI Medical Group is the largest organization on hair restoration globally. But my personal mission and aim is, of course, for the company to grow, but more important, to provide education, to provide the tools and the instruments for the hair restoration industry as a whole, because I believe if the industry changes, DHI would benefit. The daily session have a very strict protocol. On arrival, an assistant of the doctor receives, or the nurse receives the clients, and they go through all the, let's say, bureaucratic procedures, documents, photographs, washing the hair, cutting the hair, to prepare the patient for the actual session. That takes about half an hour. And then half an hour, the doctor starts with local anesthetic, similar to a dental, and the procedure begins.
So at this stage of the procedure, doctors will get a consent from the client to ensure the design of the hairline and the distribution of the hair is according to their needs and wishes.
We have calculated that placement is around 8 square centimeters. The density we need to do is a little bit less from the center. So by placing around 35 grafts, that means around 70 hair per square centimeter, will increase it maybe a little bit less than the existing. So it's going to be a good density actually. So the typical client is worried about his appearance. He's worrying about how he will look like after the procedure, and he thinks that he can make something good for himself. So most of them are in the age of 25 until 35 or 40, and we can help them actually, I think.
In the future, as a young man, he's going to lose more hair. So we don't want to go too low, so we deplete the donor area for future use. So we have to plan for future uses. A lot of guys in your age, they would like to have it a bit lower, but we purposely don't want to do it too low, because we think you're going to lose more hair in the next 10 years.
He's 23 years old.
23 years old. So this is a safe, let's say, zone for you to keep hairlines on for the rest of your life. So this way. Some clinics, having said that, if you go to them, they will go 1 centimeter lower if you ask them to. Most people, including you and me, they will need 4 mega sessions on a lifetime to get the maximum possible results. So I always tell them, think ahead, 4 sessions, 4 visits to a clinic, and 20,000 pounds. You have to have this in your mind to really plan on a lifetime scale. Of course, you can start as a small session, you can start with 3,000 pounds, and then plan additional sessions later on, but overall, this is the plan for most cases. This can be 10 different designs by 10 different people. So this is what we call the DHI hairline design, because it's conservative and safe. So safety is first, so it doesn't have to have a problem no matter what happens in the future. So safety number 1, to look natural number 2, and number 3 is maximum density possible. In that number 3, you never achieve in one go.
The medical part, let's say, is 20–30% maybe. The rest, I think, is artistic mind. I think I have the artistic skills, and I have made them much more accurate and better these 5 years. It's an artistic, it's a total commitment to perform a proper hair restoration session. You have to feel how these people feel.
Now that the area is anesthetized with appropriate agent, the doctor will carry out the extraction of the hair follicles using our fine instruments.
The punches we are using starts from 0.7 millimeters, and usually we use 0.8 and 0.95 millimeters, depending on the diameter of the hair follicle and the conditions.
We'll select the appropriate size of punches, implanters, according to the circumstances of the client. And the other equipment that we have are sterilized instruments, including forceps and scissors. We'll use it in conjunction with some sterile disposable equipment.
The implanters are unique and adjustable of the depth and the size of the graft. We can adjust it exactly and to have the correct angle when we are placing, starting from 15 degrees up to 45 degrees maximum. The importance of the angle. This is maybe number one. If we place in the correct angle, nobody will understand that we have made hair transplantation. So usually we see strip surgeries coming to us to repair with an angle 90 degrees or 80 degrees.
1/3 of our patients in all clinics around the world, they are what they call repair cases. Like the guy came in earlier today and he had 5 strip cases before, and you could see his scalp was very manipulated, a lot of scar tissue, and a very difficult case for us to correct. His only chance now is for DHI to correct his previous work and to improve it. Before FUE there was only the strip surgery. Strip surgery, you remove part of the scalp, you have to stitch it up, and of course it is more involved surgical procedure. Yet it's what 99% of the clinics around the world do today. That's fine, but it's not for us the best option. We started the FUE, let's say, development. Then we moved on to more advanced type of FUE, which is the DHI Direct, where there is less manipulation, there are smaller instruments that are used. Most of the FUE procedures, they have to use 1 millimeter diameter extractor. We use 0.7 or 0.8 smaller instruments, which are very difficult to train our doctors to do, but we have managed to create the new protocols with smaller instruments custom made for DHI. Hi, we're here in the DHI clinic in London with David and Gary from Sanio Corporation in Texas. We're just here to discuss a bit possible improvements on the instrumentation that we use in the DHI technique.
Yes, we've come over to help with your existing tools that you use in your procedure and look for ways that we might be able to improve those for you.
We have a lot of knowledge in cutter technology, but we don't have a lot of first-hand knowledge in actual surgical procedures. So it was good to be able to see a procedure taking place and our tools being used, and it's going to lead us to, I think, some very good improvements for your next generation tools.
That's our aim, is to constantly improve our protocols, our procedures, and our instruments. So we are looking forward to the new, improved generation of instruments. So with smaller instruments and a different protocol of how we extract and how we place them. So that's a very advanced form of FUE that eliminates a lot of the human factor mistakes and also the manipulation of the grafts after extraction. We never have infection. We never had the problem clients complain that this is a painful thing. It looks always natural. So we have eliminated all the factors. It is quite advanced compared to FUE, which we developed, and of course it's a whole different story than strip surgery.
So just now the doctor has already prepared the hair follicles in the donor area, ready to be extracted using our direct hair implantation technique. In a moment, you'll see the hair follicle will be extracted directly from the donor area, loaded into the implanters and then onto the recipient area.
We are working usually with 1 or 2 assistants. When we are doing the semi-direct, which is with the extraction part first, takes around 3 hours to finish the extraction when it's a mega session or a little bit more, and another 2-3 hours for the placement when it's a mega session also. Extracting follicles, we are placing in a safe place over ice in 4 degrees. So the assistant takes the follicles, only looks if every follicle is in a good condition, and doesn't do anything else. So the handle is the minimum, so the survivor is very high, over 90%. The speed I can walk starts from around 400 grafts per hour and can become until 800 in an hour. That means when we have a straight hair, an easy extraction can go up to 700 to 800 grafts per hour. When we have a difficult case with curly hair, can be around 400 per hour.
The assistant is trained to load the DHI implanter and to pass it quickly to the doctor so he can proceed with implantations. I don't think our patients deserve even one hair follicle to be destroyed. So it's up to our doctors and of course up to us to educate them and to guide them through this route to perform small sessions. She's been talking a long time because she can't comb her hair back because it makes a bit of a break here, so it has little spots, so she wanted to cover them up. So she's coming today to have a session.
Female hair loss, we have to be very accurate because women usually need big densities. That doesn't mean we cannot achieve, but when we start to place in a woman, we have to start when the area has around 60-70 hairs per square centimeter. That means we have some gaps and we can increase the density with 30-40% each time. So when a woman comes, have to go first to a GP to see if the hormonal problems are okay, if something else is happening. Usually they are coming after 50s, and then we can explain how can we help them.
It's very confusing today for most people to really find specific, clear information. I do a lot of webinars, I do a lot of seminars, I present all over the world. I presented more than 30 papers, and I'm invited to universities and medical meetings to discuss and present the DHI system as a whole. Even though at surface we do hair restoration, such as 300,000 other clinics in the world, if you take step by step our protocols, everything we do from diagnosis to the treatment to the follow-up is totally different. Our mission in hair restoration to make sure we create an environment of safety that's monitored by internal and external controls, receives exactly the same safe, successful treatments.